What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. And I'm your regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Welcome to Exposé. This is your regular host, Tony Akinyemi. We are talking about medical systems in the month of May and June 2021. And we started looking at the various medical systems already. We have talked about conventional medicine, otherwise known as orthodox medicine or allopathic medicine. That was the first conventional or the first medical system that we looked at. Number two, we also looked at osteopathic medicine. Those who study conventional medicine or allopathic medicine have MD in front of their names by North America. Those who studied osteopathic medicine have DO in front of their names. One of these days, I'm going to bring an osteopathic medical doctor and interview her on this program. And then the third one, we're looking at the third medical system that we're looking at today is chiropractic medicine. Chiropractic medicine. It was founded by Dr. Daniel David Palmer, or otherwise known as D.D. Palmer. Chiropractic medicine has an orientation towards the musculoskeletal system. It propounds the theory of one cause, one cure for all diseases. Its belief is to restore structural distortions in the body to normalcy, and then function too will be restored. You will recall that that also is part of osteopathic medicine. Okay? Dr. D.D. Palmer once said, and I quote, he said, displacement of any part of the skeletal system, or any part of the skeletal frame, displacement of any part of the skeletal frame can, press against nerves. And when nerves are compressed, the nerves are the channels of communication. That will intensify or decrease their capacity. And that can create either too much or not enough functioning, or an aberration in the body known as disease. So this is exactly how he said it. He said displacement of any part of the skeletal frame may press against nerves, which are the channels of communication, intensifying or decreasing their capacity, creating either too much or not enough functioning, an aberration known as disease, Daniel David Palmer. Now, this was how he developed a system of spinal manipulations to restore health to patients. And this system of spinal manipulation is what is now known as chiropractic medicine. There are so many chiropractic doctors around the world, particularly in North America. There are a few of them in Nigeria. I have met, I think, one or so in Nigeria. There are about 2 or 3 clinics around Nigeria that have chiropractic doctors in attendance. But they are not too popular, they are not too known, they are not, many in this part of the world. They have DC in front of their names. They will have, say, Dr. James Peters, DC. That means Doctor of Chiropractic Medicine. The fourth medical system we're going to be talking about is homeopathic medicine. Again, I have only met one homeopathic doctor in Nigeria since I started, finding out around. But of course, there are very many, particularly in Europe. I understand that even the royal family in England actually utilizes homeopathic medicine a lot. So it's one of the medical systems, one of the oldest medical systems in the world. It has 4 basic concepts in homeopathic medicine. The principle of similarities, the principle of proving, the principle of the single remedy, and the principle of potentiation or dynamization. I'll be explaining that. And by the way, I will also by the grace of God, invite a homeopathic doctor that I know in Nigeria and interview him so that he can shed more light. All I'm doing is to just let you know that there are other medical systems in existence, and there are practitioners of these medical systems, and they have modalities that can be very useful and helpful. I have a senior friend also who is a homeopathic doctor. He's actually a conventional doctor who later trained as a homeopathic doctor. He's actually a consultant neurologist who has practiced, I think, in Canada and other parts of the world before coming back to Nigeria to settle and set up a clinic in Nigeria. Again, I'll be interviewing him and letting you get to know where his practice is and what is unique about homeopathic medicine. Okay, so what are the basic principles of homeopathic medicine? The principle of similarities. In other words, it says choose for every attack of illness a remedy that can produce a similar malady to the one it is to cure. A remedy that can produce a similar malady to the one that is to cure. Now, for example, if somebody gets malaria, one of the symptoms of malaria is fever. The person can have high temperature, body temperature. So fever is one of the symptoms that a person has malaria. Of course, fever is not a symptom of malaria only. It could be a symptom of other forms of infections as well, or other conditions. But what homeopathy says is that if you are going to use a remedy to treat a particular malady, if you administer that remedy, it should be able to produce similar symptoms as the malady that remedy is to treat. Of course, when the homeopathic doctor comes here, he will tell you more about that. So you see, in allopathic medicine, the remedies they use are anti-this, anti-that, or anti-this, anti-that, as we call it in this part of the world. Anti-malaria, antibiotic, anti-diabetic. But in homeopathy, they don't use anti, opposed to. They use something that produces similar symptoms. That's called the principle of similarities. So instead of anti-this, you have pro-that. Okay. The second principle in homeopathic medicine is the principle of proving. You want to know what symptoms will be caused by a particular remedy if that remedy were to be administered to a healthy person, somebody who doesn't have that disease. If you give him that remedy, what symptoms will be produced by that remedy? That's called the principle of proving. You want to prove what that remedy can simulate. And then the third principle in homeopathy is the principle of the single remedy. In other words, a single remedy should be used at any given time. In homeopathy, they don't combine several things together, you know. In naturopathy, they can give you 4 or 5 different supplements to take at the same time. But in homeopathy, they try to use one single remedy per time so that they can see the effect of that particular remedy. It's called the principle of the single remedy. And then the fourth one is called the principle of potentiation or dynamization. In other words, the less the quantity of the remedy, the greater the effect. So that's why they dilute and dilute and dilute their remedies until you only have traces of it, therefore. So it is not actually the chemical remedy that is the substance to produce the desired effect, but it is the energy, the energetics, as it were, in the remedy. So the more dilute it is, the less the quantity, it is believed, the greater the effect it will have on the body. That's called the principle of potentiation or dynamization. So homeopathy is more or less like opposite to allopathy in its medical philosophy and paradigm. Now, the fifth medical system we were talking about is naturopathic medicine. That was founded by Benedict Lust, L-U-S-T, Benedict Lust. Now, it came by his personal experience. Benedict Lust was treated for tuberculosis by one Australian therapist called Sebastian Knapp, who used just water. He used water therapy to treat Benedict Lust, who had tuberculosis. And when he got well, it fueled his interest in natural approaches, for treating diseases. And so he came up with a medical system that utilizes natural approaches, non-invasive approaches, to treat conditions. And he calls it naturopathic. In other words, natural remedies, naturopathic medicine. So naturopathy as a medical paradigm actually flourished in the United States during the lifetime of Benedict Lust. His appeal, however, waned after his death. The moment he died, interest in naturopathy began to go down. It was not until about the 1970s that naturopathy began to resurface very powerfully again in North America. And naturopathic doctors have ND in front of their names. ND stands for Doctor of Naturopathy, as against MD, Doctor of Medicine. So when you see MD, that's allopathic medicine. When you see DO, that's osteopathic medicine. When you see ND, that's naturopathic medicine. And there are many institutions and, in fact, even universities in North America that train people with degrees in naturopathic medicine. Then, naturopathic medicine has 6 basic principles. 6 basic principles that it uses as the underpinnings of its practice. The first principle, they use different Latin words, which I can't pronounce very correctly. The first one is called primum non nocere, which means first do no harm. That's the principle of naturopathy. First, do no harm. The second principle is the principle of the healing power of nature. Look for something natural, not synthetic, something in nature. Maybe herbs, maybe vitamins, maybe minerals, whatever it is. Air, sunshine, water, natural substances, and deploy the power of nature in attending to people who are sick or people who are well who don't want to be sick. The third principle of naturopathy is to discover and treat the cause of disease, not just the effect, not just the symptoms. Treat the cause and not the symptoms. So if somebody has fever, don't just give analgesic, okay? Somebody has pain, don't just give painkiller. Look for what caused the pain and address that, and then the pain will disappear. The fourth principle of naturopathy is treat the whole person. Don't just take a part of the body, which is one of the things that happens in allopathy. In allopathy, you have a cardiologist who specializes just in the heart and cardiovascular diseases. You have a neurologist who specializes in the nervous system. You have urologists. You have a dermatologist. You have gynecologist. You have all kinds of specialties. In naturopathy, there is not much of that kind of specialization. The whole person is taken as one entity. It's not broken down into parts and you are specializing in one part. You treat the whole person, not just parts. The fifth principle of naturopathy is the physician is a teacher. In fact, the word doctor actually means coach. It means teacher. It doesn't mean somebody who diagnoses and treats diseases. It doesn't mean somebody who administers injection or remedies. The word doctor actually means a teacher. That's why those who are academic doctors, PhD holders, are also called doctors. You have Dr. XYZ. He's not a medical doctor. Maybe he's a PhD holder in mathematics, and yet we call him doctor because he's such an expert in that subject that he becomes a teacher, a coach in that field. So we call him doctor. So in naturopathy, the physician is seen as a coach, a teacher, who teaches his patients what to do. So the patient participates. That's why in some integrative medical centers, they don't actually refer to their patients as patients. They call them partners. Partners. In fact, some of them call them campers. They come to a camp, so to speak. You know, it's like soccer players who assemble in the training camp and they have their coach, and the coach is coaching the campers. So some integrative medical centers will call their patients campers. Some will call them guests. Some will call them partners, because you partner together. The physician and the patient partner together for the journey. So the physician is a teacher. Okay? It's unlike allopathic medicine, where when you ask too many questions from your doctor, he gets angry. Or when you come up with suggestions, he says, are you going to teach me my job? Okay? They just write and scribble some illegible things, take it to the pharmacy, fill your prescription, just follow the instruction. One in the morning, one in the afternoon, one in the evening. Don't ask me any question. Okay? That is the attitude of some doctors in this part of the world. Of course, that is changing in many parts of the world. I tell people, if you go to the hospital and you sit in front of your doctor, feel free to ask questions, because number one is your body. Number two is your money. You're the one paying for that service. Some people in this part of the world will go for medical checkup. Their doctor will write some, tests for them to carry out. They will carry out the test, and the results will be out. They will not even share the result with the patient. They won't even give the patient a copy of the result. So when some of those people come to see me as a nutritionist and they say, hey, I've been to the hospital, I've been given this medication, I'm here so that you can talk to me about my diet and lifestyle. And I say, what test have you done? Can I see the result of those tests so that can help me to counsel you about your diet and lifestyle and what have you? And they will say, well, I don't have the results. Why don't you have it? He said, the doctor refused to give it to me. That is the kind of attitude we have in this part of the world. That is really, really archaic. It is your body, it is your money. You paid for that test, and you can get a copy of that test so that your physician sits with you and has a conversation with you, and you partner together in the journey, your journey to recovery. The sixth principle of naturopathy is prevention is the best cure. Say prevention is the best cure. Okay? So in other words, you don't have to wait until you break down. You don't have to wait until you fall sick. You can actually start doing things now to preempt and to prevent disease. These are the 6 principles of naturopathy. Number 1, first, do no harm. Number 2, the healing power of nature. Number 3, discover and treat the cause, not just the symptoms. Number 4, treat the whole person. Number 5, the physician is a teacher. Number 6, prevention is the best cure. Now, thankfully, there are naturopathic doctors beginning to show up in this part of the world, in Nigeria in particular. I know 1 or 2, and one of these days, I will also be interviewing a naturopathic doctor so they can share perspectives with us. Now, each of these medical systems have their strengths and they have their weaknesses. If somebody has, trauma, broken bones, fracture, or an emergency situation, I will not suggest that person should go to a naturopathic doctor, for example, or a homeopathic doctor. I would say go to your, conventional medical doctor. Go to, the hospital, your bone doctor. Go and see the person, who can attend to you in the emergency room, in the trauma situation, okay? And they can, attend to you. Orthopedic doctor, physiotherapists, and all of these different specialists will do better in that regard. But if you have a chronic disease condition like diabetes, like hypertension, like arthritis, and like such other chronic degenerative conditions, definitely these other modalities have a lot to offer. We're going to take a short break now, and when we come back, we will continue this conversation on the medical system. Welcome back. This is Exposé, brought to you by the Shepherd's Flock International Church. I'm happy to be your regular host, Tony Akinyemi. We are discussing medical systems, and we have looked at several of them. We've looked at allopathy, we've looked at osteopathy, we've looked at homeopathy, we've looked at chiropractic medicine. Now we're looking at naturopathy, which is the 5th medical system. Now, I've mentioned the principles of naturopathy, 6 of them, and I want to expand them further now. Now, the first principle is primum non nocere. First, do no harm. See, in naturopathy, the physicians doctors of naturopathy follow 3 precepts to ensure their patient safety. Number 1 is they use low-risk procedures and healing compounds, such as dietary supplements, herbal extras. They also use homeopathic remedies, that have few or no side effects. Number 2, they look at symptoms as the body's effort to self-heal, and they don't suppress symptoms. So if somebody develops fever, for example, in allopathy, they will give you medicine to suppress the fever, to bring down your temperature. In naturopathy, no, they will not suppress that symptom, because naturopathy believes that your body developed the high temperature to deal with the infection. And so why stop the body from doing its job? The body may cook up a fever in reaction to a bacterial infection so as to create a destructive environment for the bacteria. Now, fever, however, will not be allowed to go dangerously high, because if it goes too high, if it's a child, the child can begin to convulse, for example. So there's a way it is monitored and regulated so it doesn't go over the bar. And then number 3, naturopathic physicians customize each diagnosis and treatment plan to fit each patient. It is not one size fits all. We all heal in different ways, and naturopathic physicians respect our uniqueness, our diversity. We are all different, and they respect our differences. And so there's no one size fits all. It's not the same thing that is given to everybody that has hypertension. The same remedy, the same medication. No. Each person is looked at as a unique individual and attended to that way. Now, the second principle in naturopathy is the healing power of nature. Naturopathy recognizes the body's inherent ability to heal itself, so the body is supported and encouraged, and all the building blocks that the body needs to work, they are all supplied: amino acids, minerals, essential fatty acids, and so on and so forth. Then number 3, naturopathy identifies and treats the cause of disease. Tolli causam, that's the Latin. It addresses the root illness by treating the cause of the symptoms, so that when that person is well, the symptoms will not return again because it has been uprooted. Then number 4 is the whole person is treated. It treats each individual by considering their physical makeup, their mental makeup, their emotional makeup, their genetic makeup, the environment in which they live. For example, somebody may be living in a house. The other day, my daughter is dentalist and allopathic doctor. We were in a particular house, and she looked around and saw some mold all over the place, and she said, "Oh, this is a sick building." and somebody said, "What does that mean? Can buildings be sick?" Of course, there are some things within a building that can make those who live in that building to be sick. If you have mold all over the place, you have what they call sick building syndrome. And people who live there can inhale the toxic substances emitted by the mold, and that can make them sick. So when you are treating a person in allopathic medicine, they don't look at just the person, the physical component, the mental, the emotional, the genetic. They also look at the environment where the person is living. Are there things that need to change? Or should the person relocate from that environment? If somebody has leukemia, for example, cancer of the blood, and the person is living in close proximity to a power line, electricity power line, or to a telecommunication mast, they would likely advise the person to relocate from that environment if you truly want to heal. You have to remove the things that are assaulting and insulting your body. They look at the social environment, they look at the gender, they look at the spiritual uniqueness and makeup of that person. And number 5, the doctor is a teacher. Okay? Doctors teach patients how to eat, how to exercise, how to relax, how to nurture themselves physically, emotionally, and how to be responsible for their health. That is naturopathy. Don't go away again. I'll be back very shortly. Welcome back. We are talking about medical systems, and we have looked at several medical systems. We are currently on naturopathy, and we are looking at the principles of naturopathy. I have expanded on 5 of the principles so far. Now, the 6th principle is the prevenir principle, which is prevention. Naturopathy emphasizes proactiveness through disease prevention, assessment of risk factors and hereditary susceptibility to disease, and then appropriate interventions are made to prevent illness. Naturopaths believe that, number 1, the vast majority of illnesses are due to an accumulation of toxins. That's why detoxification is one of the core protocols in naturopathy. Naturopaths are less concerned about trying to label a disease by giving it a name, by coming up with a diagnosis. Oh, this person has this, has that. You just say, look, let's remove all the toxins in your body. Let's create homeostasis, balance in your body. Let's help your cell membranes to be able to assimilate nutrients and eliminate waste. Let's improve your circulation. Let's improve your oxygenation. Once we normalize and balance all the imbalances, you're likely going to get well. So it's not as important to label a person by a particular disease name as to bring order and harmony and balance into the person's body. Again, naturopaths believe that, we have to focus more on establishing the proper functioning of all the systems of the body. The cardiovascular system, the immune system, circulatory system, excretory system, lymphatic system, integumentary system, every system of the body. Just balance all of them out. The person will get well. Naturopathy emphasizes on wellness and well-being, prevention, as well as non-invasive treatments. And modalities that are used in naturopathy include detoxification, nourishing, stress management, regular exercises, massage therapy, lymphatic drainage, herbal remedies, homeopathic remedies, nutritional supplements, immunotherapy, hydrotherapy, oxygen therapy, ozone therapy, you name it. These are modalities that are meant to support the body's inherent healing processes. Now, the next medical system we are going to talk about is TCM, or traditional Chinese medicine. Now, traditional Chinese medicine teaches that man is a microcosm of the universe, and the universe is the macrocosm. One is micro, M-I-C-R-O, the other one is macro, M-A-C-R-O. So they believe that the human body is a microcosm of the universe, whereas the universe is the macrocosm. Now, in traditional Chinese medicine, it is believed that any one organ of the human body can serve as a microcosm of the entire body. Consequently, one can examine certain organs of the body and see the entire person, how the person is. Now, for example, in traditional Chinese medicine, they can look at the eyes and examine the eyes to see what could be going on in the entire body. So the eyes can be used to diagnose something going on with the heart, with the kidneys, with the liver, with the bones, and so on and so forth. And that modality is called iridology, where they, through the iris of the eyes, they can try to examine the eyes and then see the entire body and diagnose some conditions that may be going on, some pathologies that may be going on. That's called iridology. They can also use the foot, the sole of the foot, for example. Different points at the sole of the foot are acupuncture points, and they can examine it to diagnose things that may be going on in the entire body. That's called reflexology. And then they can also use the ears, the earlobe, the outer ear, and different portions, acupuncture points around the ear, and be able to, examine the ear to diagnose disease in other parts of the body. That's called auriculotherapy. Auriculotherapy. Now, TCM modalities include acupuncture, acupressure, auriculotherapy, and so on and so forth. They also use Chinese herbal medicine in the practice of TCM, traditional Chinese medicine. In acupuncture, disease is said to be caused by a disruption in the flow of qi. And so a thin needle is inserted into points that are called meridian points that are believed to be the culprits in the illness so as to relieve pain, induce anesthesia, or treat various diseases. In fact, in medical literature, it has been reported that they have used acupuncture to actually anesthetize patients for surgery. They didn't administer any anesthesia. They just put needles in certain parts, and they will numb the pain, signal in the person's body, and the person can undergo surgery without feeling pain. Acupressure is based on the same principle of qi. The difference is that rather than insert needles, pressure is exerted to those meridian points on the surface of the body, either to relieve pain or to induce anesthesia or to treat various disorders. And auriculotherapy is the practice of inserting needles into the external ear to treat diseases elsewhere in the body. Okay. The seventh medical system we'll be talking about is African Traditional Medicine, ATM. African Traditional Medicine uses herbs, roots, decoctions, concoctions, incisions, incantations, rituals. Like I said in the beginning, we do not necessarily endorse all of this. We're just telling you what happens in these systems. For example, the use of herbs is okay as far as we are concerned. Roots, decoctions, concoctions, all those are fine. But when it comes to incantations, incisions, and rituals, those ones are demonic. That is the aspect of African traditional medicine that can bring spiritual contamination. And we need to be very careful about that, particularly those of us who are people of faith. Christians who indulge in incantations, incisions, and rituals as practiced in some aspects of African traditional medicine are actually exposing themselves to demonic forces, and that could be very risky. Most practitioners of African traditional medicine are witch doctors. They make animal sacrifices to strange gods. They perform all kinds of satanic rituals to appease deities and demons. We do not subscribe to that at all. Sometimes they even have to make certain incantations before they pluck a particular herb and use it to make their health potions. We do not subscribe to all of that. We believe that herbs, leaves, vegetables, fruits, seeds, nuts, as God has made them, they carry all the medicinal properties, prophylactic and therapeutic properties that we need. We don't have to say any particular incantations or invoke any kind of spirit or perform any kind of ritual before we can make use of these herbs. Now, some practitioners of African traditional medicine believe that the rituals, the animal sacrifices, and the incantations are necessary to invoke the therapeutic or healing powers of the herbs, as well as appease the gods that may have caused the disease in the first place. All of these are completely contrary to our Christian culture. Now let me say a word about the term herbalist and the term witch doctor. A herbalist is one who knows herbs and their various therapeutic and prophylactic applications. That's a herbalist. But a witch doctor is someone who may use herbs as well, but mainly consults a spirit medium to invoke satanic powers to achieve his desire. So a witch doctor may also be an herbalist. But a herbalist is not necessarily a witch doctor. But in this part of the world, we use the two words interchangeably. We say, oh, he's a herbalist, and we think of him as a witch doctor. No. A person can be a Christian, can be a child of God, and be a herbalist. In other words, he knows herbs and the medicinal uses of herbs. That doesn't make him a witch doctor. But anybody who involves spiritism, sacrifices, rituals, incantations, and incisions, and all of those invocations, that one is a witch doctor. Herbalists treat diseases with the same approach that is used in allopathic medicine. Instead of using pharmaceutical drugs, they use herbs in its place. First of all, the symptoms are identified, and a herb or a set of herbs are administered to address the symptoms, but not the disease per se. Then there's another medical system from Asia, very popular in India in particular. It's called Ayurveda. Ayurvedic medicine emphasizes maintaining balance and harmony with the universe on both physical and spiritual levels through meditation and optimum lifestyle. There are aspects of Ayurvedic medicine that I personally endorse, but there are aspects that I do not necessarily endorse. Now, each person should understand, according to Ayurvedic medicine, each person should understand their body types, so that they can eat the type of food that promotes health or healing for their unique body types. Now, Ayurveda talks about 3 different body types. They have the Vata body type, V-A-T-A. They have the Pitta body type, P-I-T-T-A. Then they have the Kapha body type, K-A-P-H-A. So the Vata body type, they say such people who have such body types, they eat and sleep erratically, they are prone to anxiety, to insomnia, to premenstrual syndrome and constipation. That's the Vata body type. And then those with Pitta body type suffer from acne, ulcers, hemorrhoids, and stomach ailments. Those are things that are common to that body type. And then the Kapha body type, those people are prone to high cholesterol, obesity, allergies, and sinus problems, and what have you. Of course, the Bible does not allude to this concept of body types. So the concept of eating according to your body type does not really have any biblical foundation. Some aspects of Ayurvedic medicine, for me, are not in alignment with our Christian concept. Ayurvedic modalities include purification or detoxification therapy. They also believe in exercise, which we also believe in. Sunshine exposure, which is very good. Breathing exercises, which is very good. The use of herbs, sometimes pharmaceutical therapy, nutritional therapy, massage therapy. All of those are fantastic. But there are aspects of Ayurveda like transcendental meditation, yoga, which I personally do not subscribe to. Okay. So these are the mainline medical modalities. Of course, there are, comparisons that we can make among the various modalities. But when it comes to integrative medicine, what we are looking at is how do we bring the best of Ayurveda, the best of traditional Chinese medicine, the best of African traditional medicine, the best of naturopathy, the best of homeopathy, the best of osteopathy, the best of chiropractic medicine, the best of allopathic medicine, and all of these modalities, and bring all of them together under one roof. That's what we call integrative medicine. And we are believing God that one of these days we'll be able to create such a world-class medical center where all these modalities will be available, and it will be a one-shop stop for everything that everybody needs for their wellness. If you need surgery, it will be there. If you need any form of therapy, ozone therapy, you will find it there. Undermed, you will find it there. Detoxification, you find it there. Hydrotherapy, you find it there. Colonic irrigation, coffee enema, you find it there. Massage therapy, aromatherapy, even physical therapy, because there are doctors of physical therapy, DPT, available out there in North America. I have not met one in Nigeria so far. Maybe they exist, I don't know. I've never met them. DPT, doctors of physical therapy, because there are people who have issues like tinnitus, some people call it tinnitus, okay, ringing in the ear, people who have balance issues, people who have vertigo, or some people call it vertigo, all of these things, dizziness that may be caused by, dislodgement of certain crystals within the inner ear, which physical therapists can help to address, which may not be addressed by conventional medicine. So there's so much that we can bring together under one roof. We call that integrative medicine, functional medicine. Subsequently, after today, as from next week, I'll be bringing medical experts in all of these various medical systems. We'll be having Dr. John Tor, who has worked with the FDA in America, the Food and Drug Administration in the USA, as an investigator, who has also worked with one of the leading pharmaceutical companies in the world. He will be our guest next week by the special grace of God. We will be interviewing him on functional medicine, integrative medicine, and he will tell us a lot about what is available there. Thereafter, we'll bring a herbologist, somebody with a PhD in taxonomy, PhD in herbal, in agricultural science, and with emphasis on the study of medicinal herbs and what have you. That person will also be coming, who is a lecturer in one of the frontline universities in Nigeria, Dr. Bengaoye. Will also be here from the Obafemi Awolowo University. We'll be interviewing him. We'll be interviewing another doctor, an osteopathic medical practitioner, doctor of osteopathy. We'll be interviewing a doctor of naturopathy, a doctor of homeopathy, and a conventional doctor, doctor of allopathy, doctor chiropractic doctors. All of them will be on this platform, one after the other. Don't miss it. Please tell your friends. There is a lot that you can be exposed to by way of information that will be very useful on your wellness journey. We welcome you to join us every Monday, 8 p.m. Nigerian time, and have a wonderful time with us as we share these pieces of information. Don't forget, what we need is not more medication, but more education. And the best prescription is knowledge. Thank you again for your time. Don't forget to subscribe to our YouTube channel. Also press the notification button so that you are notified whenever we come on air. Then make sure you like us on Facebook, follow us on Instagram, and tell your friends to come to our YouTube channel. All our past episodes are available. You can view them again and again. You can share them with your friends. And as you give them information, they will thank you for what you are doing for them. God bless you. Have a wonderful evening. Bye-bye.
My name is Olanike Aladeshuyi, a graduate of Rafa Institute of Healthy Living, a school run by Reverend Tony Akinyemi, where we are taught how to take care of our health using basic healthy living principles. My coming into contact with the school has changed my life for the better. Prior to that time, I had been diagnosed of arthritis. I had pains all over me. I had difficulty in breathing. But since I decided to take the principles taught in the school seriously and I followed them, I discovered that my health has improved. I am free of pain. My breathing has stabilized to such an extent that I can run a gym. Can you beat that? So, I want to invite you. Come, join us at Rafa Institute of Healthy Living. Let's learn together how to reverse supposedly irreversible diseases using nutrition and lifestyle. All are basic principles. Your life will not remain the same again.